Hey everyone, so welcome to the last set of disorders that we'll be looking at. These are the personality disorders. Just before we get into it, just keep in mind these are probably the most controversial set of disorders. The main reason why is when you look at them, there's a lot of them, and we're only going to go into detail about two of them, is a lot of them, the symptoms overlap. So people with personality disorders are often diagnosed with more than one. Also, people disagree on whether all of them exist. They're described in DSM-5 in two different sections. The one that I took this information from is the older way of looking at the personality disorders. And I did that because it's what's in the main section of the DSM-5. But they also proposed a new way to look at the personality disorders. It's in a separate section in the DSM that they may be moving to in the future. So again, it's a little bit controversial. I think you'll see why as we go through. So first, what are they? So it's an enduring pattern. If you remember this key phrase, this is about personality as well. So an enduring pattern of inner experience and behavior that deviates markedly from the expectations of the individual's culture. And this is manifested in two or more ways. So how they think, affectivity, meaning how you express emotion, interpersonal function, how you interact with other people, and or impulse control. It's also pervasive and inflexible, has an onset of adolescence or early adulthood, is stable over time, and leads to distress and impairment. So these are all of the types of personality disorders, almost all of them, that I won't be going into more detail about, but I wanted you to at least see them and hear about them. So first, paranoid personality disorder. This is a pattern of distrust and suspiciousness, like that other people's motives are interpreted as ill-intended towards them. Schizoid personality disorder is a pattern of detachment from social relationships, meaning they don't really want to form relationships with people, and a restricted range of emotional expression. Schizotypal personality disorder is discomfort in close relationships, cognitive or perceptual distortions, and eccentricities of behavior. Histrionic personality disorder is someone who's like really overly emotional and attention seeking. Narcissistic personality disorder. This is where a person displays a pattern of grandiosity, the need for admiration, and the lack of empathy. Just an aside, there's been quite a few articles written lately about whether Donald Trump would qualify for narcissistic personality disorder. A lot of people would say yes. You can look up if you're interested. Avoidant personality disorder is a pattern of social inhibition, feelings of inadequacy, and hypersensitivity to negative evaluation. Dependent personality disorder is someone who's submissive and clinging to other people. They have an excessive need to be taken care of. And then last, obsessive compulsive personality disorder. Notice this is a little bit different than, not a little bit, quite a bit different from obsessive compulsive disorder. This is where a person shows a pattern of preoccupation with orderliness, perfectionism, and control. Think of it kind of type A-ish, but this is much more severe and invasive to the person's life. I think a lot of times when people throw around OCD because they like things really neat and orderly and must be a certain way, those people are probably, and I'm not saying they automatically are this, but they're probably closer to obsessive compulsive personality disorder than they are to actual obsessive compulsive disorder. These personality disorders are divided into clusters. So you have cluster A, B, and C, and they're grouped according to common characteristics. So cluster A includes individuals that often appear odd or eccentric. You can see this includes paranoid, schizoid, and schizotypal. Cluster B includes individuals that often appear dramatic, emotional, or erratic. So this includes antisocial, borderline, and I'm going to talk about those two separately, histrionic, and narcissistic. And cluster C involves people who often appear, sorry for that typo, as anxious or fearful. So this includes avoidant, dependent, and obsessive compulsive personality. Here's the problem though, these clusters are really controversial. Some people say they have serious limitations, and having these groupings here aren't consistently validated, meaning maybe these don't only just have these things in common. And the other problem is people often have a high rate of comorbidity of personality disorders. So, for example, you might have someone who might be paranoid and histrionic, or borderline and dependent. Um, so, classifying them just as dramatic, emotional, erratic, or anxious or fearful doesn't really work if you have someone that falls into both categories. Contributing factors, and I did just this one slide for both antisocial and borderline. First is genetics. So studies show that people who have biological relatives that have antisocial and unemotional tendencies are at increased risk for antisocial behavior. One example of this is people, especially with antisocial personality disorder, show little autonomic nervous system arousal and have lower levels of stress hormones than people in the general population. Another example, contributing factor, is on brain scans, looking at people's how their brains are acting. People who are murderers have reduced activity in the frontal lobes and have less impulse control, and they actually respond less to other people's facial expressions, which lets us know that they feel less empathy than the general population. And this falls for antisocial personality disorder. Environment, sometimes they have traumatic events when the person is young, but not always. And if we look at the biopsychosocial perspective, it's probably a combination of all of these things. So genetic predisposition, societal factors, and how a person thinks about what's happened in their life. So we see this combination of both nature and nurture. So the first one we're going to look at is antisocial personality disorder. So what is it? So it's a personality disorder in which a person, and it is usually a man, not always, but usually, exhibits a lack of conscience for wrongdoing. Should say conscious, like conscience, for wrongdoing, even towards friends and family members. And the person may be aggressive and ruthless, or a con artist. Symptoms of antisocial personality disorder. So again, this idea of a pervasive pattern of disregard for and violation of the rights of others occurring since age 15. So they have to have symptoms from when they were younger, as indicated by 3 or more of the following. So first, failure to conform to social norms with respect to lawful behaviors. So they might do things that are against the law a lot. B, deceitfulness, as indicated by repeated lying. They might use fake names for things. They con people just because it will help them out or because they think it's fun. C, they're really impulsive. They don't like to plan ahead. D, they might be really irritable or aggressive. This might be seen by them having a lot of physical fights. E, they don't look for safety for themselves or for other people. F, really irresponsible, indicated by repeated failure to sustain consistent work behavior or to pay money for people that they owe money to. And G, lack of remorse. If they did something wrong, they might be indifferent or just rationalize, saying, I don't know what you're talking about. I didn't do anything to that person. I didn't hurt them in any way, when in fact, most people without antisocial personality disorder, it's very obvious to them that they harmed someone else. This just a cartoon way of summarizing lots of these things. So if this helps you, you can pause it and take a closer look. So the rest of the symptoms, criterion B, the individual has to be at least 18 years old. C, there's evidence of conduct disorder with onset before age 15. I'll give you a little summary here. So conduct disorder is a disorder that typically arises in childhood and is characterized by the violation of the basic rights of others or of societal norms. So there's a huge long list for conduct disorder if you wanted to look it up, but it includes things like aggression to people or animals, destruction of property, deceitfulness or theft, and serious violations of rules. And the last criterion, the occurrence of antisocial behavior, is not exclusively during the course of schizophrenia or bipolar disorder. So before I continue, I wanted to clarify something between antisocial personality disorder and psychopathy, or hearing someone called a psychopath. Well, first, if you've heard the words psychopath or sociopath, sociopath tends to be an older term for psychopath. And here's the thing with psychopath. It's kind of a controversial thing. So psychopathy is not actually listed in the DSM, and in fact, it's listed as synonymous with antisocial personality disorder. But there's some research, particularly a psychologist named Dr. Hare, it's Hare, who says psychopathy is a separate disorder, personality disorder, from antisocial personality disorder. So I wanted to explain that. So psychopathy is a set of emotional and interpersonal characteristics marked by a lack of empathy, an unmerited feeling of high self-worth, and a refusal to accept responsibility for one's actions, as well as antisocial behaviors. So psychopathy, if we looked at the prison population, first of all, about 50 to 80% of all prisoners probably meet the criteria for antisocial personality disorder. And out of that percentage, about 15% of male prisoners and about 7.5% would qualify for this idea of being a psychopath or having psychopathy. The most common determinant to see if someone is a psychopath or has psychopathy, as opposed to just antisocial personality disorder, is the Hare Psychopathy Checklist. It's a 20-item scale where a person is rated on a score of 0 to 40, where anyone scoring 30 or above would qualify as being a, quote, psychopath. That's combined with the results of an interview by a clinician to determine if someone meets the criteria of psychopathy. We'll be looking at someone in class tomorrow, Ted Bundy, if you've heard of him, who would qualify for both psychopathy as well as antisocial personality disorder. So people with psychopathy would also qualify as antisocial personality disorder. There's just a more rare, kind of extreme version of it. Before I run out of time, let's talk about borderline personality disorder. So what is it? So it's a personality disorder that's characterized by volatile emotions, an unstable self-image, and impulsive behavior in relationships. So the symptoms, and this is all I'm going to go over with this, are these symptoms. So it's a pervasive pattern of instability in interpersonal relationships, person's self-image and affects, and marked impulsivity beginning by early adulthood and present in a variety of contexts, as indicated by 5 or more of the following. So first, number 1, or A, frantic efforts to avoid real or imagined abandonment. Whether that's friend or a loved one, they're going to do anything to keep that person from leaving them, except harming themselves, like self-mutilating or suicidal behavior is not part of A. B, a pattern of unstable and intense interpersonal relationships characterized by alternating between extremes of idealization and devaluation. C, identity disturbance, so markedly and persistently unstable self-image or sense of self, oftentimes really low sense of self or low self-image. D, impulsivity in at least 2 areas that are potentially self-damaging, so spending, sex, drugs, driving recklessly, binge eating. E, recurrent suicidal behavior, gestures, threats, or self-mutilating, like self-cutting behavior. F, instability due to marked reactivity of mood, like being really irritable. G, chronic feelings of emptiness. H, feeling really intense anger, someone having difficulty controlling their anger, like they get into fights all the time. And I, transient stress-related paranoid ideation or severe dissociative symptoms. Sorry for the typos. Okay, all of these borderline personality disorder. Again, I will show you some examples in class. That's all for the notes. I will see you all in class.